The safety net is becoming less safe, and it's leaving more people living without a net. Tonight, we'll look at the latest moves that the White House is doing that are bad for people struggling to make ends meet. Then why critics say the president is supporting policies that benefit him personally, and he isn't even trying to hide it. Also, our special look at how Puerto Rico is rebuilding after Hurricane Maria. FIOS 1's Ray Ramundi visited the island to see rebuilding efforts with his own eyes. That includes hospitals, Red Cross missions, and even his own family members whose houses were destroyed. Good evening and welcome to RFL. I'm Andrew Whitman, in tonight for Richard French. And we begin with a look at the middle class and lower class in this country and how things could start getting a lot tougher for them in everything from banking to taxes to health care. We've spoken a lot about the new Republican tax law that will pull a reverse Robin Hood by helping the rich and hurting everyone else, especially as you look down the road. A recent study shows that over the next decade, people making less than $50,000 a year, they're going to see their tax burden soar by more than $5 billion. And people who make more than $1 million, they're going to see the opposite, a total tax reduction of nearly $6 billion. And that's not happening in a vacuum. Just today, the administration made a move that could be the largest change to Medicaid since it was enacted more than 50 years ago. For the first time ever, states will be allowed to impose work requirements that will surely reduce the rolls. And critics say that's just the point. The Wall Street Journal saying the administration is ready to roll back Community Reinvestment Act rules that help poor people get loans. And then there's Obamacare. We already know that the GOP tax plan could kick as many as 13 million people off their health plans. We now also know that the administration has a plan to try to kill the whole thing. Politico getting its hands on documents showing the White House's plan to obliterate all of the Affordable Care Act via executive actions. That, of course, would leave tens of millions more people scrambling to get covered, and those won't be the 1%ers. So to discuss, we introduce tonight's panel. Tonight, Richard Brodsky is here, former Democratic State Assemblyman from New York. He's also a professor at NYU. Next to him, Dominic Carter, political journalist and author. And on the other side of the table, conservative strategist Bill O'Reilly. And Richard, let me start with you. Ever since the safety net was first implemented, first Social Security and then Medicare, Medicaid, and you can add the Affordable Care Act to it, there have been efforts to try to undermine it, dismantle it, attack it, bring it down. Is this the most coordinated and concerted effort that you can recall?
Well, the simple answer to that is yes, but the more complicated answer is that there's always been sort of a difference between what were called welfare programs, those safety net programs, and healthcare. And healthcare was viewed as something that, to some degree, united the rich, the middle class, and the poor. Everyone should get the same treatment. We need one kind of system. Whether you have single payer or not isn't the point. We need a unified system. By turning healthcare into a welfare program, they're trying to change the politics of healthcare. And in the end, I don't think they're going to be successful, but it's an attempt to demean and diminish people whose healthcare requires some public support.
Bill, we know that one of the conservative arguments for this is financial, that the deficit is booming, particularly after the tax cut bill, and this is a way to help trim costs and perhaps even prolong, we've heard from Republicans, Medicare, Medicaid, which they say are unsustainable. Is that the extent of it, or is there a sort of larger argument that that's not what government should be doing?
It's philosophical. A lot of it is philosophical, and that's that this administration, and to some extent I support the idea, is trying to give states more options to do things like the Medicaid proposal, which would never fly in New York, and I don't know if it'll fly in any states. I mean, you've done it for welfare to workfare type thing, but Medicaid is a different step. But they want to give states more latitude to make changes in very expensive programs. That's what underlies this.
That's nonsense, Bill. This is the same administration that goes out and says you can't do state-by-state gun laws. They pick the subjects
I agree.
they believe in
I agree.
state rights.
It's completely inconsistent, but I think from the fiscal conservatives in Washington, on the Federalist side, that's the thought is along the idea of block grants is let states experiment with ways to get costs down.
But Dominic, when you start looking at these individual issues, Medicare and working in exchange for that, and there's almost a meanness to this approach.
Almost a meanness?
Yeah, I'm going with almost. You can make it all the way.
Well, because I've lived through this. I've covered this for many, many years. It depends, and I mean this not being sarcastic, but it literally depends on how you define work for the Medicaid now. We've seen this in New York City. Rudy Giuliani, in a sweeping wave, brought in, we all know, workfare. even tried to push, in some cases, for college students to be forced to do workfare. That didn't go initially so well. But when I say define work, and it's funny the word that Mr. Brodsky here used, because he's right, an effort to demean. Many of these types of jobs are demeaning. In the past, we have seen people as part of their workfare, and everyone knows who they are, which makes it very demeaning, have to get out and clean parks. Now, some will say that's a good idea. Perhaps it is a noble idea. But how would you like to be forced to get out there and have to clean the park, and everybody knows that you're getting this as a
Let me ask you
benefit?
a question. Do you see a difference between what are called welfare programs and health care in this? Does it, with the notion that someone who is
point was right.
able-bodied should be working is not a terrible idea. But the point is that people who need health care should be treated the same way. That's where I think the meanness,
But then how is this different from the welfare reforms that we saw during the Clinton administration, where workfare was sort of instituted and you have to work if you want to be on welfare?
It's different in the fact that the healthcare has never been viewed as a form of, as a charity. It's been viewed as something of a right,
More of an
something
entitlement than exactly.
that human beings have a right to, and that the sicker you are, the more you use the system, the less likely you are to be able to work anyway.
And just with the one problem that I've seen with workfare is that it's not fair, because those with political clout get the best type. There are some communities, for example, that are exempt from workfare requirements, as quiet as it's kept. Okay?
That shouldn't happen. I happen to like workfare, and I think all work is noble. But I do understand Richard's point about Medicaid, where it's, if someone's sick, you don't want to say, and get out there and mow my lawn. I mean, that's not right.
There's also an assumption that these are public sector jobs that are going undone, when it's not clear to me that the mandate that you're talking about isn't that people could satisfy it by working in private sector.
And I thought conservatives didn't like the number of public sector jobs. They want to reduce those, and here we are.
Which was part of the idea. Remember, Parks Department, some of the Parks employees went crazy. You were working in the city at that point, I was too, and they went nuts when that proposal came down. I think, the states will be wary about implementing this, because you're right. Some of the lower and middle class, working class people are going to get hit on this. That's going to cost them votes.
It would be easier to take this stuff if it wasn't accompanied by these shoveling cash to the super wealthy. If it was just about a principled kind of thing, but it's about income transfer.
And Andrew, I know you're out of time, but there's also a sentiment that we don't want to talk about that comes with these types of maneuvers of these people that are getting these benefits are lazy, they don't want to do anything, they're shiftless, so we've got to make them be responsible.
Do we think that still applies when it comes to Medicare and Medicaid? I mean, I understand with welfare you're not working, but
that's exactly what they're trying to do.
But do you think that it will resonate with the public like that? If somebody's got a health condition, then they're getting
Andrew. There's 37% of the nation that it will resonate with, no matter what it is.
Well,
and the rest not so much.
And springboarding off that point, Bill, we know that when we break down who voted for whom in the last presidential election, these kinds of restrictions are going to impact more Trump voters in more Trump states than they will, Democratic voters in Democratic states. How do you keep that sales pitch to Trump voters and have them not turn on it?
Republicans are putting an awful lot of eggs in the economy basket. They're banking that the tax cuts to, yes, wealthy people got them, corporations got them, is going to kickstart the economy enough to get things moving.
Is that unemployment rate below 4.1?
Well, fractional is 5, so it's not going to get much below that. But you want wages up, you want the salaries up.
Richard, you want inflation up.
Oh, you have to have some inflation. You have to.
Is that the right answer? That it's all going to be the economy, or are Trump voters not going to hear these stories? Are they not going to see these stories?
Well, there is some evidence that it doesn't matter what he does. He represents an attitude and an anger that transcends individual policies and actions, and that seems to be now.
But he's angry at some of the people who are going to be angered by it. You know what I mean?
He's not driving the policy. This is coming out of the House.
Oh, but the White House has signed off on this
because they'll sign off
significantly.
He'll sign off on anything they put in front of him. And that was the whole point. I mean, is that's why they stomach him, is because they hand him something. It sounds like a success. He'll sign it.
There's pushback on this in the Senate because McConnell doesn't think he can get the votes, but the White House and the House want it. They definitely want it.
Right. The House took the lead on this, and to them, it's really a federalist thing. It's moving things to the state, giving flexibility.
But Andrew, do we define success at the end of the day as saying 1 million people didn't want to do workfare or whatever, and now the Medicaid rolls are 1 million less? Is that how we're going to define success?
Some people
Partially,
would define
yes.
that as success because it saves money. And
I would to some extent, and there's probably, I mean, I think you would agree that there's people out there that definitely abuse Medicaid.
No. This is not about fraud. The problem with that theory is that people who fall off the system are eventually going to end up in the hospital. You're not going to.
Well, they're going to end up back in Medicaid.
All right.
But they're going to end up in the charity pool as opposed to the regular program.
And we'll leave it there. We'll take a break. When we come back, is the commander-in-chief chiefly concerned with doing things to benefit himself? It's a question a lot of people are asking after the latest moves from the White House.